Knock knock. Providing privacy. Washing my hands. Hi, my name is Jessica. I'll be your student nurse from Chamberlain. I am here to do a head to toe assessment. It shouldn't take any more than 20 minutes. Is that okay?
Yes.
First, before we get started, can you, I'm sorry. This assessment is to make sure everything is working okay and that you're healthy, okay? It's a head to toe assessment. Can you please go ahead and identify yourself, your name and date of birth for me?
Portia Moore, 8-1204.
Great. You have any pain?
No.
Any allergies?
No.
Okay. So on a pain scale of 0 to 10, 0 being no pain, 10 being the worst pain you ever felt, how would you rate your pain today?
0.
Okay, great. Okay. So I'll go ahead and start with this assessment. General appearance. There is no signs of acute distress noted. Facial expression and mood is appropriate for this assessment. Based on my patient respond, her speech is clear. And can you tell me where you are today?
I'm at home.
You were?
At home.
Okay, what year is it?
2020.
Okay, and why are you here?
For a head to toe assessment.
Okay. And what's my name?
Jessica Johnson.
Great. Okay. Okay. My patient is alert and oriented. Time 4. To person, place, time, and situation. Great. Okay, moving on to skin and nails. Hold your arm out for me. Skin color is even throughout and appropriate for race and age. There's no lesions or wounds. Have you had any recent surgeries where you might have an incision? No? Okay, great. Okay. And then as I touch the patient's skin, her skin is warm and dry. Okay. Okay. And then her nails, they're clean, pink, slightly curved nail beds, of one nail bed of 160. Okay. Cap refill, I'll be checking, is 1 to 2 seconds. Looks good. No ridges, clubbing, or lesions. Okay. And your skin is warm and dry and intact. Looks good. Okay. So moving on to your head and face. Okay. So upon inspection, the patient facial features are symmetrical. Okay. Is it okay to feel your head? Yes. I'll go ahead and feel her head. Normal cephalic. No infestations or lesions noted. Okay. Okay. Can you close your eyes? I'll lightly touch your chin, your cheek. Let me know if you feel something. Say yes.
Yes. Yes. Yes. Yes.
Okay. Clench your teeth together for me. Okay. I'm assessing the TMJ. Thank you. Okay. Go ahead and smile. Puff your cheeks. Wrinkle your forehead. Okay. Turn your head left and right. Up and down. And, yeah, rotate. And shrug your shoulders. Okay, great. Okay. Crank. Based on the assessment, the cranium nerve 5, trigeminal, cranium nerve 7, which is facial, and cranium nerve 11, that's sensory, or all intact. Okay, so now moving on, I'll inspect your eyes. Looking at my patient, her eyes are symmetrical. There's no discharge or redness noted. Okay, can you pull your bottom lid down for me? Conjunctiva is pink and moist, sclera is white. Pupils, okay. Her pupils are round, equal, and reactive to light. The size is 3 millimeters. Okay. Okay. So now I'm gonna check for accommodation, okay? So if you can follow my pen light. And I'm checking for the 6 cardinal fields of gaze. Okay, follow my pen light again. 1, 2, 3. 1, 2, 3. Good. Okay. This was assessing cranium 3, oculomotor, cranium nerve 4, which is trochlear, and cranium nerve 6, which is abducens. They're all intact. All nerves are intact. Pupils are equal, round, reactive to light with accommodation. Great. Okay, moving on. Moving on to your ears. As I inspect your ears, there is no discharge coming from her ears. Okay. I'm going to whisper something in your ear and repeat back to me.
You're doing great. You're doing great.
Great. Okay. This was assessing the cranium nerve 8, which is vestibular coca, and cranium nerve is intact. Okay. So now I'll go ahead and move on to your nose, okay? Upon inspection, the nose is symmetrical. There is no deformities. There is no drainage, inflammation. Okay, great. I'll go ahead and assess for bilateral patency, okay? You'll go ahead and include one nostril, one at a time, and blow or breathe in. Okay. Same thing, opposite nose. Okay. Great. Both nostrils are patent bilaterally. Okay. So now moving on to your mouth and throat. Okay. I'm gonna have you open your mouth for me. Upon inspection. Okay, go ahead and open your mouth. Lips, tongue, gums, and mucous membranes are all pink, moist, and intact. Okay. Say ah and stick your tongue out. Say ah. Okay. Great. Okay. Say light, tight, and dynamite.
White, tight, dynamite.
Okay. Great. Okay. Okay. Now this was assessing the cranium nerve 9, glossopharyngeal, and cranium nerve 10, which is vagus, and cranium nerve 12, which is hypoglossal. And the nerves are all intact. Okay, great. Okay, moving on to your respiratory system. Upon inspection, there is no signs of accessory muscle use. The breathing is unlabored. And now I'll go ahead and auscultate the anterior lung fields and a Z pattern, okay? Okay, I'll start with the diaphragm of the stethoscope. Okay, starting with your breathe normal for me. Now go ahead. Start with the right upper lobe. Breathe. Left upper lobe. Right middle lobe. Left lower lobe. And then the right lower lobe. Great. Now can you turn around for me? Okay. Now I'm gonna auscultate the posterior lung fields, starting in a Z pattern and starting with the left upper lobe. Okay. Right upper lobe. Left lower lobe. Oops. Right lower lobe. And then I'll re-auscultate the lungs again. Starting with in the same pattern, starting with the left upper lobe. right upper lobe, left lower lobe, and then the right lower lobe. Okay. Her lungs are clear and no abnormal crackles present. Okay. Now I'll go ahead and start with the cardiovascular system. Okay. 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 Now I'm gonna just look at her lower ankles. There is no edema noted. Okay. And then I'll go ahead and palpate your carotid one at a time. Okay. And then your radial pulses bilaterally. And then I'll check your dorsal pedis post, which is on the top of her foot. And then the posterior, bilaterally. And then the posterior tibular. Inside. Okay. Then the posterior tibialis. Okay. And then now I'll go ahead and listen to your heart using the diaphragm of my stethoscope. I'm going to listen to the aortic first. Right sternal border. Right sternal border. And then the pulmonic. Second intercostal. And the aortic was the first intercostal. The Erb's point. Left sternal border. Third intercostal. And then the tricuspid. Left sternal border, fourth intercostal space. And then the mitral. It's the mid-clavicular line, fifth intercostal space. And I'm going to do the same thing using the bell side of the stethoscope. Same pattern, aortic, pulmonic, Erb's, mitral, tricuspid, self-identified, right? Tricuspid and mitral. Great. S1 and S2 is noted. S3 and S4 is absent. Okay. So now I'll go ahead and do the gastrointestinal. You go ahead and lay down. Okay. Lay all the way flat. Okay. So the abdomen is flat and contour. It's symmetric. Okay. And then I'll go ahead and auscultate your bowel sounds, starting with the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And then bowel sounds are present, and then I'll go ahead and palpate in the same area, lightly. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay. You have any pain or tenderness? No? Okay, great. You go ahead and stand up. So there's no pain or distension noted. Okay, great. Okay, moving on to the musculoskeletal system. Okay, so now, I'll go ahead and assess your upper extremities, okay? Upper major and minor joint. Okay, I'm gonna go ahead and start with her elbow. So I'll go ahead and palpate her elbow. Same contour, same they're both symmetrical in shape and contour. Okay, great. Okay. And now can you follow along with me? I'm gonna show you different range of motions, okay? Okay. So we're gonna do flexion now. You still recording? Okay. Flexion, extension. Okay. And then down, supination. Okay. Pronation. No, I'm sorry. Self-identifier break. Supination is like soup. Give me soup. Pronation is down. Okay? Great. Okay. Great. You can go ahead and relax. Okay, moving on to your wrist, okay? Up. Up is extension. Flexion is forward. And hyperextension is back. Okay, great. Okay, and range of motion. Move it around. Okay. Okay, so can you turn your hands inward for honor deviation and out for radio deviation? Okay, great. Okay, looks good. Okay, moving along. Okay, so now what I'll do is, so we did twirl the wrist, right? Okay, yeah, okay. So now I'll go ahead and do your resistance with your elbow, and we'll be done with the elbow, okay? Elbows up again, okay? So push against me, okay? And don't let me pull you, okay? Testing for strength. Okay, and same thing for your wrist. Okay. Great. Okay, upper extremities are symmetrical bilaterally with same contour and full range of motion. Great. Okay. So moving on to your lower extremities now. I'm gonna assess your major and minor joints in your legs, okay? Okay, in the lower extremities. Okay, so now I'm gonna ask you to follow along with me. Okay, up is flexion, down is extension, kick is hyperextension. Same thing, opposite leg. Up, flexion, down, extension, kick, hyperextension. Back down, good. Okay, so now with your ankle, I'm gonna ask you to do dorsiflexion, it's up. Okay, down, plantar flexion. Okay, in is inversion. And out is eversion. Same thing for the other leg. Okay, down, dorsiflexion. No, down is plantar flexion. Up is dorsiflexion. In is eversion. And then out. In is inversion. And out is eversion. Okay, so dorsiflexion is up and plantar flexion is down. Right, okay, right, okay. So now I'm gonna do your resistance. You're testing your strength, okay? Go ahead and sit down for me. Okay, don't let me push against you. Great, okay. Don't let me pull. Same thing for your ankle. Don't let me push against you. Don't let me pull. Good, okay. So now I'll test your sensation. Okay. Let me know if it's light or dull, okay? Say light or dull.
Light.
Is it dull?
Light.
Okay. Okay, now I'm gonna assess your gait. I'm gonna ask you to walk towards me. And walk back. Good. Patient has a good steady gait. Okay. So this includes the head to toe assessment. Thank you so much for your time. And I'll, are you in pain?
No.
No pain? Okay.
0.
From 0 to 10, how would you rate it?
0.
0, great. Okay. And I'll go ahead and lower your bed to the lowest position. Give you your car light, your side rails up. And then your bed is locked. And do you have any questions for me?
No.
Okay, you have your car light. I'll go ahead and wash my hands. Thank you so much for your time. Have a good day.
Have a good day.